Welcome to the Organic Instinct Health and Wellness podcast, where we dive deep into the insights of living a healthier, more vibrant life. I'm Daria Kuchikali, your guide on this journey towards a holistic health and well-being. Here at Organic Instinct, we believe in the power of nature, the wisdom of ancient practices, and the advancements of modern science to create a balanced, nourishing lifestyle. Today, we are excited to introduce our special guest, Dr. Khan, an esteemed general practitioner with 20 years of experience. Dr. Khan is the owner and director of Dr. MK & Co., located in Campbellfield, Melbourne. As a fellow of the Royal Australian College of General Practitioners, he is highly respected in the medical community. It's quite an honour to have him with us today. He has a keen interest and experience in weight management, mental health and dermatology, with a particular interest in weight loss, which is going to determine today's topic for us. He is here to share his insights on the latest trends and treatments in the field, including the use of weight loss injectables. In this episode, we'll explore the science behind these treatments, their effectiveness, and what you need to know if you're considering them. Dr. Khan, thank you so much for joining us today.
Thank you very much, Daria, for inviting me.
Thank you. Doctor, the topic today is heavily going to be based on weight loss and weight loss injectables and just natural measures to lose weight. And the reason why we've got you on this podcast today in particular is because not only are you our favourite doctor, you are very holistically aligned. We love the fact that you do everything in a very holistic manner with your patients. And considering our topic of weight loss today, in Australia, we're noticing that statistics are showing that, 65.8% of Australians are either overweight and obese. And this is an alarming statistic. And I'm sure that it's multifactorial as to why. And no guesses to why. That's a lot of the problem with this is because we live in a very fast-paced society. Fast food is at our fingertips. We work 9-to-5 jobs, 5-6 days a week. Convenience food, packaged foods, a lot of sedentary lifestyle jobs where we're sitting at desks are contributing to this. So it's a lot of lifestyle factors, as well as naturally there'd be some genetic factors involved. And unfortunately, the end result of overweight and obesity are some chronic conditions that can lead to cardiovascular disease, various types of cancers, diabetes, and hormonal issues, which, for our clientele, which are predominantly women, we're seeing a lot of PCOS and endometriosis and hormonal disruptions of the like. Now, you're a very health conscious individual. We know that you're an early bird, you're a gym goer, you care about quality calories versus empty calories. It's a huge area of interest to you, and you live, talk, preach, walk the walk of health and wellness. So we would like to ask you, when we approached you as to what topic you'd like to discuss with us today, you said weight management. Why is that?
Well, I believe weight management is applicable to all of us, regardless of what ages, what ethnicities are, what roles are in the society. And I think people are usually intrigued about knowing the latest methods of weight loss. And in addition to that, I'm passionate to talk about it because I believe by maintaining a healthy weight, you can prevent a number of medical conditions. So that's the reason why I've chosen this topic.
Well, I'm going to dive straight into my first question. I'm sure our followers and viewers are keen to know, what is the most effective and sustainable weight loss approach for the average person?
All right. There's no one size that fits all. So when I see patients, when they approach for weight loss, normally as a clinician, so I'd like to give my insight as how a clinician approaches a patient. It's a two-step process. So we take history and then we manage. So when it comes to history, every individual is different. For example, we start with the psychosocial aspect. Are they married? Are they single? Do they have children? Is a female in a postpartum state? Is she lactating? What are their working hours? Do they do sedentary jobs? Are they tradies working outdoors? What are their expectations of weight loss? What have they done in the past? Are they on any medications? Is there anything that's holding them back? How active they are? Are they smokers? Are they dependent on some medications? What supplements have they taken? What have they done in the past? What is their day-to-day chore? What are they doing? For example, if there's a female, she has 2-3 kids, she needs to look after the family. How much time does she have for herself? So all these things matter. So that's the psychosocial component. Then comes the medical component. You mentioned a few things. Is there an underlying mental health issue? Are they on medications that are holding the metabolism down? So there are multiple medications that can reduce metabolism. Is there underlying metabolic condition? Do they have metabolic syndrome? Do they have PCOS? So for individuals, PCOS is polycystic ovarian syndrome, in which females go through irregular periods, excessive follicles associated with excessive facial hair and acne. Is there underlying endometriosis? Is there an underlying thyroid dysfunction? So overfunctioning or underfunctioning can lead to metabolic dysfunction. So basically, those who have underlying thyroid function, they lead to obesity. They can have reduced metabolism. Those who have overfunctioning, they can lose excessive muscle mass. Now, is there an underlying cardiovascular condition? Is there an underlying diabetes? Do they have underlying musculoskeletal disorders? Can they actually go to gym or not? Do they have any disc problems, disc prolapse, rheumatoid arthritis? They cannot sustain weight strength exercises. Then comes their mental health. How motivated are they? Are they anxious? Are they depressed? Are they able to get up and do things? So we need to cater for their individual needs. Then comes the history of their diet. What do they take in their breakfast? What are they taking in their lunch? What snacks do they take? Do they binge eat? What about BMI? So BMI is body mass index, where we measure the height against weight. And there are certain parameters that we keep in mind. What is the healthier weight range? What have they done? How do they expect themselves to look in 6 months? Are their goals short term or are their goals long term? How do they expect themselves to look in the next 5 years' time? Are they doing this weight loss because of an event that's coming through? Is there an engagement, a wedding? Are they preparing for some CrossFit? Are they preparing for some marathon? So it depends what they plan for. Then comes exercise. Do they actually work out? Some people need, for example, if it's a tradie, he may not need more than 45 minutes in gym versus somebody who does a sedentary lifestyle. As a sedentary lifestyle, they can be sitting on their jobs from 9 to 5 and may not be able to work out.
Yes.
So based on that history, as clinicians, we come and approach them and we're like, okay, let's manage you now. So there is no one size that fits all.
That is exceptionally comprehensive. You are looking at all facets of their life
Absolutely.
before you prescribe anything, or whether it be a health plan or whether it be a medication. That's really, really intensive. That's a fabulous approach, I think, for people who are struggling with weight issues, which, brings me to my next question. Now, we understand that there are some people that do all the right things to lose weight and to maintain healthy weight, yet they're struggling. What would be some common reasons for this, and how do you determine the cause?
Okay, so weight loss starts in your mind. It never starts in the kitchen. It never starts in exercise. So first thing is the question I ask them, how far are you ready to go? What have you done? Have you tripped? For example, they've tried crash diets. They've tried keto diets, carnivore diets, and paleo diets. Sometimes it works, sometimes it doesn't. But most of the diets people opt, they're not sustainable. So we need to understand, we need to opt a lifestyle where you can have foods that you enjoy, that are healthy,
Yes.
that are catered for your individual needs, and then you move forward. Next thing is, at times, some people have an amazing willpower. They can do it. They can get up in the morning, go cold turkey, give up on old habits, and move forward. Well, I've seen in my practice, 80% of the people, they lose hope because they can't see results. The reality is results take 6 to 8 weeks. So I'll just mention something there. When it comes to mindset, we're still in the mindset. There's something called neuroplasticity. So when we're learning new skills, it takes 6 to 8 weeks before a new center is developed in your brain, so your neurons expand. Learning to eat healthy, going on a weight loss journey is a skill. It is going to take 6 to 8 weeks. You may not get results. Sometimes you may get results. And again, those who fail to achieve their goals, my recommendation is to liaise with a psychologist. So normally, now, I refer patients to psychologists. That's the first approach. If this is the area of need, we go from there. Now, if they're motivated and they're still not getting the results, as you've asked why they may not get results and they're doing the right things, then you need to ask, please tell me about your dietary approach. What have you done? What's your calorie intake? Are you in calorie deficit? Are you overeating? For example, somebody who's 80 kilos may be healthy, and somebody who's 80 kilos may not be healthy. So it depends how much skeletal weight they have. So a skeletal muscle is the current factor that is looked upon for longevity of your health. It used to be memory, it used to be joint aches, cardiovascular health. Now, the higher your skeletal mass is, the more chances of you resisting certain conditions. That's why, as clinicians, we recommend weightlifting. So now comes the aspect of exercise. How much are they working in? Now, again, some people can make their meals, some people can't. Here comes the role of a dietitian. They can consult with them. They can get in touch with chefs who can actually prepare their food. They can consult naturopaths. They can help them with supplements. And my recommendation, they should get a personal trainer. Sometimes you can do the exercise or you can hurt yourself. So you need to have a team that can help you with these things.
You need to be kept accountable, I
Yeah.
think. And in human nature, we do tend to give up
Yeah.
when we feel like we're failing. We don't give it an adequate chance. And I think having a personal trainer is pivotal in that
100%.
success because they will keep you accountable. They will make sure that you're at the gym at 6 a.m. and not sleeping and pressing the snooze button. So working in a team to achieve your weight loss goals is probably key over here. Now, you've spoken about lots of the background. You've spoken about natural ways to go about this. You're going to have some patients that are going to come in and they're going to ask for natural methods of weight loss, which you can do by writing up a diet, having a team, etc. And then you're going to have people who are going to come in and they're going to want a quicker, more convenient fix. And that's where weight loss medication comes in, weight loss injectable comes in, and the somewhat controversial medication, Ozempic. Ozempic was, initially intended for the use treatment of type 2 diabetes. It is now a widespread medication that's being prescribed to achieve weight loss goals. We know it comes with its pros and its cons. Doctor, can you enlighten us on when and why and how Ozempic can work?
All right. So when patients ask for quick fix, my question to them is, what is their understanding of these medications, injectables or oral medications? And before I even proceed, we need to work out as to what their blood works are. So normally, as clinicians, we shouldn't prescribe medications unless we've had their bloods done. So baseline bloods like full blood count, kidney function, liver function, sugar level. What if they are prone to hypoglycemia? So hypoglycemia means low sugar level. Imagine giving them medication that would further lower their sugar levels.
Of course.
That's going to be detrimental. To assess their iron levels is important. Checking their vitamin levels are important. So once I'm done with that, which I normally do before prescribing any medication, we need to assess their BMI. Now we jump into what medications can be used. So we've got oral medications and we've got injectables. The concept of oral medication is they act on your hypothalamus. It has a center, we all have it, it's called the satiety center, so it suppresses that. That's the basis of oral medications. Now coming to the injectables that are in vogue now, one of them, which you've mentioned. Now the basics are GLP-1 agonists, that's the pharmacological name. So GLP-1 agonists, they act on GLP-1 receptors that are present in our gut, in our brain, in our pancreas. It's important to understand how these medications work. A lot of people would ask for these medications without knowing the underlying functions. The way they work is when they are injected, they can be injected once a week and once a day. There are different brands for that. They basically push the blood sugar levels from your bloodstream into your muscles. Now imagine blood sugar level going into your muscles and you have no reserve energy. So where do you think your energy is going to come from? Your body will go in a starvation mode and utilize fat, which is adipose tissue. Hence, GLP-1 agonists work by pushing and maintaining blood sugar levels through your pancreas and gut and utilize fat. So there is a fat loss when people use GLP-1 agonists. The second thing is it increases the transit time of food in your gut. For example, something that needs to be metabolized within 4 to 6 hours can take up to 8 hours. That means people can feel fuller for a longer period of time, but that can come with side effects. I'll come to those in a tick. The third thing is they suppress your appetite in the brain and makes you feel full. So they tell you, look, it's enough. But now comes the question of side effects, which is extremely paramount, and people need to understand this. It can lead to extreme nausea. So, as we mentioned earlier, if the transit time of food in your gut is longer, you're going to feel full. And if food stays within your gut, you don't feel the best. Normally, those side effects subside within a week, but some people can feel it for a longer period of time. If somebody's appetite is suppressed, they can go in calorie deficit, which can lead to something called collagen deficiency. Now, you can lose weight, but the question is, should you lose skeletal mass? The answer is no. With all these appetite suppressants, in addition to weight loss, we've seen that people start losing muscle mass as well. They may look good within their clothes or what they're wearing. However, their facial radiance is lost. Their facial muscle pad fat is lost. What do we do then? A lot of people can lead to, people can have a lot of anxiety and depression relating to that with the fear of rebound weight gain. And that can lead to other complications because most of these medications are not meant to be for long-term weight loss. Weight loss is a side effect of these medications as they were originally designed for people with type 2 diabetes. And same is true with all other oral medications.
Wow. So, I mean, we know that some of the side effects that you've mentioned, nausea and food transit time being slower, is probably more the milder type of side effects. And then there are other criticisms of Ozempic where, more serious side effects are things like pancreatitis and kidney problems and potentially thyroid tumors. And in some cases, with some of the information I've read is, and in probably rare cases, death. And all medication has some form of a risk factor. And so I suppose the question is, what is your perspective on these criticisms of Ozempic, and how do you weigh out the benefits and the potential risks when you're prescribing Ozempic to a patient?
Well, from a clinical point of view, we need to put forward those side effects. It's an informed decision by the patient. Any medication can have side effect. But when it comes to Ozempic, we need to alarm the patient. Unless you're done with certain bloods, we won't prescribe it. For example, people can have a BMI, the healthier range is anywhere from 18 to 26. So someone having a BMI of 26 and under, normally I discourage the use of this medication because then all these side effects kicks in. But if those who have BMI of 26 and above or 30 and above, and they're falling in the obese and overweight categories, they may have lesser side effects and more benefits. So it just depends.
Sure.
If the benefits outweigh the side effects and they can take it and be monitored, then of course that option is there.
So you're doing that risk assessment as a health professional for your patients.
Absolutely.
Yeah. What of patients who perhaps are past the Ozempic and injectables and weight loss medication, and they need bariatric assistance where, often I see clients come in and they're just about to go on surgery for stomach reduction and other related surgeries like that. How do you go about referring to specialists, or when do you feel that it's deemed necessary that injectables are now no longer an option? We need to take the next step, which is referring them to a bariatric specialist.
Absolutely. So it depends on their BMI. So normally those who fall in the categories of 35 and above or 40 and above, they can be a candidate for gastric sleeve or bariatric surgeries. And we do involve bariatric surgeons. More so or less, normally when they're referred to bariatric surgeons, they refer back to us that have they tried those options before. So again, most of the bariatric surgeons would still avail those options if they haven't tried those. And of course, if they've tried, they're enlisted for the procedures and they can go from there. But again, that's a separate specialty with bariatric surgeons and we work hands in hand.
Okay. Now, moving into the everyday person that's trying to lose weight, what are some common dietary mistakes people are making when they're trying to lose weight? So imagine that they haven't gone to the GP at all. They're at home. They're self determined to lose weight. What are some of the traps and pitfalls? I personally don't like the word diet. I feel like when you've blocked yourself into a mentality of I need to diet and I'll start on Monday, which never happens, you feel like you need to live a certain way. Whereas like to look at things as a lifestyle. I'm sure that you sort of, agree with that approach. If we have a lifestyle effect where we're eating, we're moving, we're getting our sunshine, we're grounding, and not focusing too many on how many calories we're eating, it's more of a better sort of mental health approach than being structured in a routine that's very limited and named diet. So what are some common mistakes people are making who just take into their own hands their approach to weight loss?
Yeah, like you've already mentioned, when people attempt doing things themselves and they fail, it means they're not doing it right. The number one mistake people do is that they're not making it a lifestyle. The diets they've chosen, the macros they've chosen, the macros they believe through social media or internet is not working for them. As we mentioned earlier, there's no size that fits all. Every individual, there are different needs. For someone who's 80 kilo and has more muscle mass and plans to gain weight has different caloric needs. Somebody who wants to lose more fat and has a BMI of over 35, they need to be in calorie deficit. So what normally people don't understand is what calories are needed for their needs. We're talking about average person without underlying medical conditions. And in that case, the other mistake they make is not approaching professionals that can help them. So weight loss is a mission. In this mission, you need a team. You need a team of clinicians, of dietitians, of naturopaths. You need a team of family members, of friends that would encourage you. Of course, if you have a supportive husband or wife when you're married, or parents that can help you out, nothing's like that. So and in addition to that, of course, your clinician can help you. And then we can add a personal trainer, as I mentioned earlier. So I personally think where people give in is when they feel there are no results based on what they've attempted, rather than taking a route where they can get help by the team members I've mentioned, and they can leverage that.
Yes, yes. You're right. I mean, diets are very fashionable at the moment, aren't they? You've got the carnivore, the paleo, the Atkins, which was, not as fashionable now. But and a lot of these, like you said earlier, are not sustainable. They do it for about a month, and then it either becomes financially not feasible because they're eating a steak 3 times a day,
Yeah.
or they're getting rid of really important macros like their carbohydrates, quality carbohydrates. I think that the messaging really is we want to reduce certain things like processed sugars, refined sugars. We want to minimize processed refined carbohydrates. Doctor, there are so many quality carbohydrates that people can consume throughout the day. They don't have to be limited and remove food groups from their diet, because this becomes, again, more of a diet culture and what's that word where deprivation. My mental health around food, when I'm told don't eat that, my body says, oh, damn well, you're going to eat that because you've just deprived me and I will not accept deprivation. So rather than having those mental stigmas around certain food groups, I think it's really important that we be able to enjoy all the food groups, but eat quality versions of them. Would you agree?
I 100% agree with that. In fact, when I prepare a meal plan for a patient, so I normally do that by consult before even jumping onto medications, there's one thing I tell them, that you need to give up refined sugars. Now, we're talking about lollies, we're talking about all the pastries and bakeries. However, after 6 days of hard work, you can have a cheat meal. It's absolutely fine to enjoy something that you enjoy. You can have, the pizza of your choice. You want to have a burger, you can have that. But 6 days a week, you need to stick to a plan. You need to work out. Now, talking about the good carbs that are your friends, talking about potatoes, rice, brilliant. You need that for muscle mass. You need that for looking good. You need that for your collagen. You cannot completely take out carbs out of your diet. It's not sustainable. People get bored. And once they bounce back, naturally, there's a weight gain. they fall into binge eating. They give in their desires to eat what they uh, always liked. And, as humans, we've got that nature that we go back to what we used to.
Correct.
So we need to develop new habits. That's the main thing. As I mentioned, we need 6 to 8 weeks before we develop that habit and we can
Yes.
further.
Can you give us, in about a minute, what is a great typical breakfast, lunch, and dinner combination?
Well, I don't believe in breakfast, lunch, and dinner.
Okay.
It's a very modern day phenomenon.
Please
If you're
explain.
not hungry, you shouldn't eat. But if you're aiming at muscle mass, professional athletes, then you need to eat in a certain way, even if you're not hungry. We need to understand if you're not hungry and you eat, your insulin and sugars, they spike in different directions. But when you are hungry and you eat, there's a balance. Coming back to a healthier version, well, you can have all the basic ones. You can have um, eggs that are amazing. Some people don't like fish. I believe you can have tuna. You can have organic rice crackers. You can have certain healthy shakes. You can have black coffee. You can have the coffee of your choice with minimal dairy in it. So I believe you need to limit your dairy intake, especially those who are lactose intolerant. And again, there are people who are gluten intolerant. They should avoid things that actually flares up their gluten sensitivity. You may have a little bit of rice. Some people like oats. I'm a big fan of taking oats. You can have wheat bix. So these are healthier carbs, and you can have protein in form of eggs.
Yes.
You can have egg whites. You can have, two boiled eggs and, 4 egg whites. Absolutely fine. But of course, we need to understand you need to burn them as well. Coming to lunch, again, it's a modern phenomenon. You should stick to basic carbs. You can have protein, you can have salad. And if you move on to dinner, you should limit your carb intake unless you've got a morning athletic session or a gym session. You should limit your carb intake after 4 p.m. There are studies about that. So you can increase your meat intake, protein, and a bit of fat will reduce your carb intake.
Okay. What are your thoughts on constant snacking throughout the day? Constantly eating every 2 hours, snacking. I personally, I'm completely against the idea of snacking. I think we're constantly putting our body in a state of high insulin, and it's constantly getting the stomach working, which even like from an Islamic perspective, this constant snacking idea is not necessarily recommended. And I'm personally more of a 2 meal a day kind of person. One in the day, one in the early evening, and not eating after 7. And I've found that that's worked really well for me in my personal circumstances. But again, everyone would differ. That's how I've found I've been able to maintain weight. What are your thoughts on consistently snacking?
Mine are slightly different. It's individual thing. I actually believe in eating every 2, 3 hours. So what happens is you don't look forward for a major meal. So if you're eating every 2 hours, your metabolism is switched on. And you can incorporate those calories within 6 meals. For example, people can have 1,500 calories in 1 or 2 sittings, and you can have those calories over 6 to 7 hours. When you're eating 5 to 6 meals, tiny meals, you can divide those, your normal 2 meal into 4 to 6 meals. You are not looking forward for a major binge. So I personally think there's no harm as long as those calories are counted.
Right.
That's what I believe.
Rather than limiting them to twice a day, 2 sittings.
Absolutely.
You're saying have the 2 sittings worth of healthy calories over a 2 hour breakup of period.
Space them out.
Right.
That way, you're not hungry.
Okay.
So I personally, it works for me.
Yes. See, I love how what works for one may not work for the other. And that individualized approach that you take with your patients is really, really important. Now, Doctor, as we conclude this very insightful podcast, I want to ask you, what final advice or encouragement would you like to give our listeners who are trying their best to maintain a healthy weight or to lose weight?
Okay, my final advice is weight loss is a journey, it's not a quick fix. So you need to mentally prepare yourself. You will not see results until you sustain a healthy lifestyle. I'm saying anywhere from 8 weeks to 12 months. And if you need to have results, you need to work hard towards them. As I said, it's a mission. You need to work out every single day. You need to maintain yourself every single day. You need to miss your favorite meals. You might have to disappoint a lot of friends and family members.
Yes.
You need to give up certain things.
Yes.
So the first advice is you need to put your foot down and say, I'm going on a mission and I'm going to do whatever it takes to attain that.
Love that. That's really important. Yeah. I mean, nothing quick is really great or beneficial in the end, is it? It's always the things that take time and effort and energy and courage, and it is where you yield the great results. Nothing great comes out of quick fixes.
Absolutely.
In anything in life, really.
Absolutely. And once you start seeing results within 3 months, within 4 months, you will think twice to bounce back because now you've seen the results. You've seen your energy. You've seen how good you look. So once you start developing that, you will not go back.
Very true. Very good point. Great concluding point, Dr. Mohammed Khan. Thank you so much for your time on our podcast today. You can find Dr. Khan at Dr. MK and Co, located in Campfield. We'll have all the details available at the bottom of this podcast for your viewing. Thank you very much for your time.
Thank you very much.
And speak again soon on many numerous
Thank
topics.
you very much. Thank you, Hips. Thank you for inviting me. Thank you very much.